Hello there, I'm Janelle Marie. Welcome to Body Beautiful, the show where we talk with local professionals about the latest in cosmetic procedures and medical devices. With us today, as usual, we have plastic surgeon Dr. Joseph Mealy. We're talking about a bunch of different stuff today, all very exciting. First up, we're going to talk about breast augmentation revision. That's interesting. Followed by gynecomastia. We're going to find out what that is. Otoplasty.
Yes.
See, I've been with you so long, I know all these. And blepharoplasty for Asian eyelids, correct?
Correct.
Yay! All right, good.
Lots to talk about.
Absolutely. Lots to talk about. Before we get started, any advice we give you today, remember you want to consult your own physician. Let's jump right in. Dr. Mealy, thank you so much for being back with me.
It's nice to be here.
I love to chat with you all the time. This is so much fun. First, let's talk about... Oh, yes, go ahead.
No, you're good.
Oh, thank you. Let's talk about breast augmentation revision. Now, everybody's heard about breast augmentation.
Yes.
We are talking about revision.
Correct.
Now, that's interesting. What are the most common reasons you go in for a revision?
I mean, the most common reason overall is more elective than required. It's just putting in larger implants.
Okay, so that's the main one.
Yeah, and sometimes it's just that, you know, from the get-go it wasn't quite large enough. But more commonly, as we change, sometimes the breasts shrink or have children. So sometimes we'll go back and put bigger implants. Other reasons are deflation. Sometimes implants wear out.
Okay.
And capsular
Do you have to replace them every 10 years now, like we used to?
There's no expiration date.
Okay.
But I would say if you look at 100 women who've had breast augmentation at 10 years, probably about 25, about a quarter of them have had a second surgery. Okay. Either for changing size, capsular contracture, or deflation.
Well, I read this one, breast implant exposure. That scares me a little. I know we're going to see the best part, the before and after pictures, but let's talk about exposure. I mean, how does a breast implant get exposed?
It's very unusual. It's more common for breast reconstruction than for elective augmentation, partly because when we do reconstruction, it's after a mastectomy, so some of the blood supply has been disrupted, and often there's been radiation, which also affects the way that we heal and the way that we can protect an implant. Okay. So with radiation, we get higher incidence of capsular contracture and infection and
capsular contracture is?
Capsular contracture, the capsule is very important. It's the scar that holds the implant in place. Okay. If it contracts, it squeezes the implant. So it can make the breast feel hard or actually move the implant to a different place and cause malposition, which is bad positioning. Now,
I know a lot of surgeons don't really like to do revisions from other doctors' work. Why do you do it? I mean, you do it well, but you kind of enjoy doing it.
I do. It's challenging. You know, breast augmentation itself is challenging because we're putting in something artificial in the body, and the way people heal is, somewhat variable. Yeah. With revision, it's more challenging because there's been surgery before. I find it easier to revise my own work because I know what I did before and I know which pathway went there, and I can kind of anticipate, if X happened after Y, don't do X again. Okay. When I don't know, then I usually review someone's operative report, see what was done before, and see if there's a reason.
It's challenging, but when you do it well, it's good.
People are very happy,
All right, let's go to the best part of the show, before and after pictures. First one, here we go. What's going on here?
So this is someone who had breast augmentation.
Okay.
There's a little asterisk there.
Yes.
So what's happened is that implant has actually moved across the midline. So she has a little bit of symmastia.
In the before picture, okay.
Correct.
So symmastia is what? Breast. They're just not
Symmastia means like one breast. They're trying to come together. It's sometimes called bread loafing.
Oh, okay.
If it's just, or a uniboob.
Oh, uniboob. We all know the uniboob.
But in this case, it's more mild. So it still looks like two breasts, but that's moved over. So afterwards, we've fixed that. And it's harder to tell beforehand because the left implant's actually deflated.
Oh, really? So they got a little deflation going on there.
So and it's a little sneaky because if you're not looking closely, it may look normal, and then you put the implant in there, and then you see the symmastia.
All right, second picture.
So this is what you were talking about.
This is it.
This is near exposure of an implant. So she had bilateral breast augmentation. The left side, it looks square at the bottom.
Yes.
What's happened is the skin has thinned out so much, the implant is eroding through the skin. That is something that's an emergency. So if it's exposed, it's going to be infected. So we want to try and get it before it's exposed. In this case, the skin was so thin, we had to remove the implant.
Wow.
And I actually had to remove a little bit of skin there to get normal skin to close it back up. And because of that, we removed the opposite breast implant too, so that things are more even after surgery.
Wow.
But you can notice the left breast is smaller and a lot higher. And that was just from removing the implant.
All right, what's happening here? That's crazy, though.
Yeah, so that one, there's better pictures of that on the website and on the blog too.
On your website, it has all the before and afters.
With the replacement and time as it heals. So there's another deflation.
Deflation,
so left side smaller than the right.
Beautiful.
And just replaced it with a new implant. Those are usually pretty straightforward. If everything looked good before, it looks good afterwards.
And what's happening
here? And here is capsular contracture.
I wouldn't have said that. I would have said not symmetrical.
In a bad place. But no, it was put in properly. It was in the right place. And what's happened is over the years, that right breast capsule has gotten tighter and tighter and pushed the implant up.
So the smaller breast is getting tighter and tighter and pushing it up.
Correct.
Oh,
yeah, it looks smaller because it's squeezed.
Yeah, it does. I'll be darned.
And the diameter reduces too. This is also capsular contracture, and you can see the different shapes on the upper pole. So one's kind of pyramid, one's rounder. Both are removed, the capsules were modified, and that way things are smoothed out. And often the nipples get moved around when the implants move underneath them, so this gets them back to where they used to be.
All right, fantastic. The favorite part, before and after pictures. We have to move along, though. For more information about Dr. Mealy, you can call 925-943-6353 or check him out on the web, and all the before and after pictures are there. drmealy.com, sanfranciscobreast.com. We're going to talk lots more. We have so much to talk about. Everything coming up. Stay right here on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.